Okay, we ready? Okay. Hello, welcome to a presentation on generalized anxiety disorder in the Diagnostic and Statistical Manual, 5th edition. My name is Matthew. I'll be doing the sections on the overview of GAD and the criteria for GAD. GAD was formally included in the DSM-3 in 1980. It underwent one change between the DSM-3 and the DSM-4, and that was the removal of the unrealistic criteria. Originally, GAD, the worries that a person experienced while they had GAD had to be unrealistic. The current criteria was included in the GAD-4 and the GAD-4 textual revision and remains in the GAD-5 today, 40 years later. The next slide, please. The criteria for GAD is listed here. This is essentially what is stated in the DSM-5. You can see that there are several components. The first and primary or criteria, A, is excessive anxiety and worry. It has to have a temporal component, meaning it has to occur on most days of the week for at least 6 months. And it has to involve a number of thoughts, not just a specific fixation. Next slide, please. If one takes a look at the remaining criteria, we see a lot of descriptions of physical phenomena. So that we could basically categorize GAD as having two main components. The first component is worry. Worry resembles rumination in persons with depression. It is constantly going over possible scenarios in your head, attempting to either stave off a potential threat or to deal with a potential threat. Then there is a somatic component. That's what's described here on this side. Restlessness, feeling keyed up, easily fatigued, irritability, muscle tension, sleep disturbances. These are somatic, probably originating in autonomic arousal. Constantly being worried about things makes an individual feel threatened, which activates the sympathetic nervous system or the fight or flight response in a very low-grade way. The combination of this worry and the somatic component leads to significant distress or impairment in social, occupational, or other important areas of functioning or activities of daily living. Finally, it has to not be attributable to substance use or some other chemical, and it's not better explained by another mental disorder. The next slide, please. When diagnosing GAD, there are numerous self-report measures, specifically the Generalized Anxiety Disorder Q questionnaire, or GAD-Q, which I believe is currently in its 4th edition. Worry can be assessed with the Penn State Worry Questionnaire, and then there are other population-specific worry scales, such as for geriatric clients. Next slide, please. One of the interesting features of GAD is that it has a high level of comorbidity or co-occurrence. Typically, throughout their lifetime, a person who has GAD, 90% of persons who experience GAD will have a co-occurring disorder, the top one seeming to be panic disorder. In some literature, it states it's upwards of 56% of people with GAD will have panic disorder. Other disorders are major depressive disorder, and social anxiety and specific phobia. When making a differential diagnosis, one should consider the potential other anxiety disorders in the DSM. The DSM-5 lists several of them, including the aforementioned panic disorder, social anxiety, specific phobia. In the literature, there are various theories about what the central feature of GAD is. For example, Robichaud and Dugas 2010 say that it is ambiguity or fear of uncertainty. So essentially one has to be able to determine the nuances between the anxiety disorders within the family, overall family and umbrella of anxiety. I take, for example, a comparison to panic disorder. which is abrupt, includes a panic attack, which is an abrupt surge of anxious or nervous energy, the belief resulting from that one is going to die. Notice that it does not have a cognitive component, or it has a very minuscule cognitive component. That's just one way that one can differentiate between these disorders. I'm now moving, that's the end of my slides, and the next person will now be speaking.
Antika, you're muted. We can't hear you.
Hi, my name is Antika. My slides will be about case examples. So I'll be looking at 2 case examples. The first is Phil, who's a 67-year-old male. He displays symptoms of generalized anxiety disorders, and this can include excessive worrying, irritability, concentration difficulties, and sleep difficulties. He's had this since he was a child. His mom used to call him a worry wart because he was to worry about everything and anything. He constantly experiences worrying thoughts about everything and anything. For example, he talked about how his wife is undergoing treatment for breast cancer and how he sees that as equally important as like when he has to return a book to the library, even though he knows that his wife's condition and treatment is more worrisome. In his brain, they're both in the similar levels of worry. In this case, Phil has trouble concentrating and focusing at his job, and he has impatience with others, and he also displays like physical difficulties, like he has significant back pain and muscle tension. So in this case, his generalized anxiety disorder has had profound effect not only on his like mental health, but also in his physical health. And in his life, his mom and his wife are both aware about his condition. So we have a second case example, and this time it is a woman in her late 20s. Her name is Sally, and she also has similar symptoms of GAD. So she said she feels restlessness or on edge, and she also has like physical pain. So she says she has joint pain and back pain, as well as throbbing headaches. In her case, her GAD is hindering her performance in school, with her family, and she says she constantly worries about school, her family, and her mother's health. So the thing about GAD, generalized anxiety disorder, is that it can have effect on the human body's cardiopulmonary, musculoskeletal, gastrointestinal, and neurological systems. So it doesn't just affect the neurological system or the brain. It can affect like many other places as well. So I feel like in both cases, even though like Phil was a male in his 60s and Sally is a female in her early 20s, they both have similar symptoms, and they both say that it hinders their life in many ways. And they both have symptoms that are both physical and mental. So that's the thing about generalized anxiety disorder. It can be both physical and mental, and it can really have a profound effect on the individuals that have this disorder. So
Awesome. Thank you, Antika, and thank you for starting us off just talking a little bit about GAD in general, what effects it can have on your mind and your physical body. So my name is Bailee. Sorry, I didn't introduce myself before. My piece is going to be about the evidence-based interventions, or in this case, I just went with one intervention that seems to be the most effective in many studies of literature all across the world for GAD, which is cognitive behavioral therapy. And it's also referred to everywhere as its shortened acronym of CBT. So Looking at just the definition or blanket definition of CBT, it is the therapeutic approach which is centered around the origins of a person's negative thoughts. Then the therapist helps them to understand how they can change the way a client may feel, which therefore changes behavior. Now, CBT, you can see cognitive and behavioral. There's two pieces to it. Now, the cognitive piece focuses on those thought processes, and the goal is to change the perceptions that someone has and those internal thought processes, which causes a client to feel a certain way and therefore changes behavior, as the definition says. Now, in addition, there's a behavioral component, which involves doing work at home, similar to homework almost. Your therapist will send you home with something to do that is meant to challenge whatever that distorted thinking that a patient with generalized anxiety disorder may be feeling, allow them to identify that distorted form of thinking, which allows them to then change it when they come back and speak to their therapist. Now, changing your thinking patterns can evolve the effect that triggering events of anxiety has on an individual that is diagnosed with generalized anxiety disorder. So in a clinical setting, therapists will assist clients with their generalized anxiety disorder by teaching them how to recognize the thoughts that provoke the anxiety, so those triggering events. And eventually being able to control them by giving them different coping mechanisms, which will change their behavior. And now going into the different forms of coping strategies, there's a couple of different types of CBT that I talk about here. And I'm going to flip-flop the emotional and behavioral maintenance with those forms of CBT. They're in the wrong order here. So relaxation is often the first intervention that is ever made, the relaxation exposure form. This is more breathing, muscle relaxation, meditation, all very physical, but obviously has an impact on your thinking. Now, versus the exposure form of cognitive behavioral therapy, it actually exposes a patient to what they're afraid of, which is a little more hands-on and can be very anxiety provoking for someone that has generalized anxiety disorder. So now they are forced directly to face and overcome whatever emotions they feel when they're exposed to those things. So now to go back to that emotional and behavioral maintenance, as Antika was saying, there's both the physical and mental component of what happens to someone that has generalized anxiety disorder. Now, they're both important because they all influence each other. As that graphic represents that I put on this slide, the thoughts, behaviors, and emotions, they all connect to each other. Thoughts and emotions are going to affect whatever your behavior is. And just as an example, this can be a fear of making the wrong decision. And that thought creates an emotion of fear, which results in a behavior of never wanting to make decisions because you're afraid of what may happen, gives you anxiety. And I just included the last bullet point there. I think, I feel, I act, because that just shows you how your thoughts, your feelings, and your emotions, your behaviors all go together in order to create this anxiety. And we can use CBT in order to fix it. Thank you. Next slide, please. Alexis, you're muted.
You're right. Thank you. I'm Alexis, and I will be going over our critical evaluation and possible interventions and connotations for GAD. As Matthew said in the beginning, individuals cannot be considered diagnosed with GAD unless they are experiencing 3 of the 6 following symptoms. And they have to be experiencing them for at least 6 months, more often than not. And for children, the symptoms are only cut down to 1. And those symptoms include restlessness or feeling on edge, becoming easily fatigued, finding it difficult or to concentrate, or that their mind keeps going blank, becoming irritable, muscle tension, or sleep disturbance, as in including the difficulty to sleep or staying asleep. And through all that, I believe that the current diagnosis within the DSM-5, I find it logical and well-rounded due to the fact that there's multiple possible symptoms that somebody could be experiencing, and that these people need to at least be experiencing them for a 6-month period before being considered diagnosed with it. And I also find it accurate to cut it down to 1 for children, just because they're still growing, they're still experiencing things. So we're not completely sure yet if they're experiencing these things as an adult would. So I find it logical that we cut it down to 1. And next slide, please. For possible interventions and connotations, I added psychotherapy or psychoanalysis, and that is simply just counseling. Medications, that could be stuff for like antidepressants, or like Matthew said, GAD can stem into other things. So if medications help lessen the symptoms of other things that they might be experiencing, the medications could definitely help with their anxiety. Social coping strategies, as far as talking to your family or friends about how you're feeling. Don't just keep it bottled up, or needing to think that you need to wait until the next counseling session. If you need to talk to somebody about something, please do it. Emotional coping strategy, simply just taking a second to breathe and just know that you're human, you'll make mistakes, it's okay, and that us growing up is a learning process all the way to the end. And then for physical coping strategies, that could be easily cooking, doing a hobby you enjoy, exercising, anything physical. Group therapy, self-explanatory. It can be found very helpful for people who are surrounded by others who are experiencing the same thing, to kind of open up more, because they feel that, or understand that those people are experiencing what I'm seeing. And so I'm not crazy for feeling this type of way. It makes them feel more accepted with their diagnosis. And then a positive connotation, I said that with GAD being such a common diagnosis and that so many people experience it, that there have been an abundant research opportunities over the years for it to be changed, like Matthew said, again, within the recent DSM changes through 3, 4, and now. And also that because there are so many research opportunities for it, with the amount of people being diagnosed with it, it also allows us to expand our knowledge and education of the diagnosis itself. For a negative connotation, I could see it, obviously, again, as Matthew stated, it can easily be led into other illnesses like substance abuse or alcohol abuse, or even depression, just because the symptoms can linger if not treated in an appropriate time. And that's it for me. And I think that's the end of our PowerPoint. So thank you for listening.
Thank you, everybody. Hope you enjoyed it.